Steve, one last question, if you don't mind. Just the GLP-1 agonists and how do you consider using them, if at all, in your HS patients?
It's funny because I'm teetering on the decision of, do I start writing them? Initially, I had been reluctant just because I thought, hey, we've got enough prior auth burden for my
Yeah.
staff to deal with. I'm not going to add on these drugs. And when they first came out, you couldn't even get them anywhere, and it was just a nightmare. But we've had a couple smaller studies. One was prospective, one retrospective, that did show benefit. One of them, when they did their multivariate analysis, the benefit for HS was actually independent of weight loss. And we've seen that with some of the psoriasis studies too, where the psoriasis starts clearing up before they really have significant weight loss. So I do believe that it's got those inflammatory pathways that it's blocking too. And I've seen, like I said, I haven't written them for patients. I've written once because longtime patient, of course, talked me into it, but it went well. But I've seen patients come back, and I've had some of those patients where we're a little bit stuck on their HS progress, kind of hovering in that like better, but could be doing better. And each visit we're tweaking things. And then all of a sudden they get on a GLP-1 and it's like, wow, now you're doing considerably better. So I do think they're going to play a pretty big role. And it will be interesting to see, even in that sense of like dual inhibition, is that going to be something we do sometime? Like you're taking a GLP-1 and a TNF at the same, like one drug, take it together. So I think that'll be really exciting. And of all our drugs, you always have to kind of talk to patients, talk them off the ledge about the side effects, convince them that it's a good idea to take it. They're apprehensive, not GLP-1s. They're like, give it to me. I love it. I want it. You're like, can we talk about side effects? They're like, nope, just give it to me.
That's so true. Yeah, that's an easy win, right? With the GLP-1.
Yeah, you're like, oh, it's a shot. I don't care.
Yeah. You might be on it for life. No problem.
Right. Every other drug, they're like, do I have to take this forever? You're like, can we just get your disease under control before we talk exit strategy?
Yeah. It's so true. I have maybe a little bit more experience than using GLP-1s for my HS patients, and I found them to be incredibly helpful. I think that the anti-inflammatory component really does make a difference. I mean, we just saw, Lilly just released their data on Tirzepatide plus Taltz plus ixekizumab, and we saw incredible synergy there for PSO. And here we're, just my anecdotal experience, really impressive what it can do. I mean, certainly it doesn't knock out the disease, but again, with the idea of how can I improve my patient's quality of life, I feel like it's worth it for them.